Philippine Sustainable Development Goals, SDG 2, Zero Hunger. End hunger, achieve food security and improve nutrition, and promote sustainable agriculture. Zero hunger. Hunger is the leading cause of death in the world. Our planet has provided us with tremendous resources, but unequal access and inefficient handling and leaves millions of people malnourished. If we promote sustainable agriculture with modern technologies and fair distribution systems, we can sustain the whole world's population and make sure that nobody will ever suffer from hunger again. Target 2.1. End hunger and ensure access by all people, in particular the poor and people in vulnerable situations, including infants, to safe, nutritious, and sufficient food all year round. Target 2.2. End all forms of malnutrition, including achieving by 2025 the internationally agreed targets on stunting and wasting in children under 5 years of age, and address the nutritional needs of adolescent girls, pregnant and lactating women, and older persons. Target 2.3. Double the agricultural productivity and incomes of small-scale food producers, in particular women, indigenous peoples, family farmers, pastoralists, and fishers, including through secure and equal access to land, other productive resources and inputs, knowledge, financial services, markets, and opportunities for value addition and non-farm employment. Target 2.4. Ensure sustainable food production systems and implement resilient agricultural practices that increase productivity and production, that help maintain ecosystems, that strengthen capacity for adaptation to climate change, extreme weather, drought, flooding, and other disasters, and that progressively improve land and soil quality. Target 2.5. By 2020, maintain the genetic diversity of seeds, cultivated plants, and farmed and domesticated animals, and their related wild species, including through soundly managed and diversified seed and plant banks at the national, regional, and international levels, and promote access to and fair and equitable sharing of benefits arising from the utilization of genetic resources and associated traditional knowledge as internationally agreed. Target 2.6. Increase investment, including through enhanced international cooperation in rural infrastructure, agricultural research and extension services, technology development, and plant and livestock gene banks in order to enhance agricultural productive capacity in developing countries. In particular, least developed countries correct and prevent trade restrictions and distortions in world agricultural markets, including through the parallel elimination of all forms of agricultural export subsidies and all export measures with equivalent effect in accordance with the mandate of the Doha Development Round. Target 2.7. Adopt measures to ensure the proper functioning of food commodity markets and their derivatives, and facilitate timely access to market information, including on food reserves, in order to help limit extreme food price volatility. These are the indicators for Goal 2. List of key government programs, activities, or projects contributing to Goal 2. First is Bangon. The Bangsamoro Umpungan sa Nutrisyon project is a convergence of services addressing the high incidence of hunger and malnutrition among children in the Bangsamoro Autonomous Region in Muslim Mindanao. Specifically, it aims to contribute to saving the lives of children who are vulnerable to dying or getting sick because of malnutrition, improve the nutritional status of children identified as underweight and severely underweight, empower parents or guardians to achieve food security and good health for their families, and build resilient communities by facilitating access to nutrition support programs. As components, the Bangon includes nutrition direct services, nutrition education, and advocacy, and building resilient communities like livelihood skills training, livelihood capital, food for work, cash for work, access to potable drinking water, production of indigenous food for children, psychosocial interventions, etc. The implementing agency of this program is the DSWD. The key accomplishments. The project did not set targets for the outcome indicator, thus 18.5% of the children served has improved nutritional status from severely underweight to underweight. Another program is the National Feeding Program. The passage of Republic Act 11037 or the Masustansyang Pagkain para sa Batang Pilipino Act of 2018 establishes a comprehensive national feeding program to address malnutrition among Filipino children. The program includes the following components: supplemental feeding program for daycare children for age 3 to 5 years, school-based feeding program for public school children from kinder to grade 6, milk feeding program to incorporate locally produced milk products in fortified meals, micronutrient supplements including the use of iodized salt, health examination, vaccination, and deworming for program beneficiaries. Gulayan sa Paralan to allocate space for the cultivation of vegetables and other nutrient-rich plants. Water, sanitation, and hygiene to establish and maintain water and sanitation facilities and promote good hygiene and good preparation. Integrated nutrition education, behavioral transformation, and social mobilization to promote a holistic and integrated approach to health and nutrition education. In addition, the law calls for the harmonization of all existing national and local nutrition databases to identify individuals, groups, and/or localities that have the highest magnitude of hunger and undernutrition. The Department of Education and the Department of Social Welfare and Development are the lead agencies in the implementation of the program. Another project is the Early Childhood Care and Development F1K. The Early Childhood Care and Development Intervention Package for the first 1,000 days has been implemented in Philippine Plan of Action for Nutrition, priority provinces since 2016. The first 1,000 days of life refer to the period between conception to the first 2 years of life and has been termed as the golden window of opportunity for the child to achieve his or her full potential in the different aspects of development. It is consistent with Republic Act 10410 or the Early Years Act of 2013, which strengthens the early childhood care and development system. The ECCD F1K program aims to contribute to the full development of the child through integrated services of health, nutrition, early education, and social services for pregnant women and children below 2 years old. It aims to reduce morbidity, mortality, and stunting and wasting prevalence among children 0 to 23 months old, and is expected to improve the quality of the country's human resource base, thereby contributing to poverty reduction. The program is spearheaded by the National Nutrition Council, initially in the 10 priority provinces outlined in the PPAN 2017-2022. SDG 3. Good Health and Well-Being. Ensure healthy lives and promote well-being for all at all ages. Good health and well-being. Over the last 15 years, the number of childhood deaths has been cut in half. This proves that it is possible to win the fight against almost every disease. Still, we are spending an astonishing amount of money and resources on treating illnesses that are surprisingly easy to prevent. The new goal for worldwide good health promotes healthy lifestyles, preventive measures, and modern efficient healthcare for anyone. Target 3.1. Reduce the global maternal mortality ratio to less than 70 per 100,000 live births. Target 3.2. and preventable deaths of newborn and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births and under 5 mortality to at least as low as 25 per 1,000 live births. Target 3.3. End the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases and combat hepatitis, waterborne diseases, and other communicable diseases. Target 3.4. Reduce by 1/3 premature mortality from non-communicable diseases through prevention and treatment and promote mental health and well-being. Target 3.5. Strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. Target 3.6. By 2020, halve the number of global death and injuries from road traffic accidents. Target 3.7. Ensure universal access to sexual and reproductive healthcare services, including for family planning, information and education, and the integration of reproductive health into national strategies and programs. Target 3.8. Achieve universal health coverage, including financial risk protection, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Target 3.9. Substantially reduce the number of deaths and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Target 3.8. Strengthen the implementation of the World Health Organization Framework Convention on Tobacco Control in all countries as appropriate. Target 3.b. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases that primarily affect developing countries. Provide access to affordable, essential medicines and vaccines in accordance with the Doha Declaration on the TRIPS Agreement and Public Health, which affirms the right of developing countries to use to the full the provisions in the Agreement on Trade-related aspects of intellectual property rights regarding flexibilities to protect public health and, in particular, provide access to medicines for all. These are the different indicators for Goal 3. List of key government programs or activities contributing to Goal 3. Public health programs. The Department of Health is currently implementing various public health programs that would provide interventions on addressing the triple burden of diseases in the country: morbidity caused by infectious diseases, mortality by non-communicable diseases, and emerging incidents of injuries, mental health, and alcohol and drug abuse. These programs are National Immunization Program, Women, Men, and Children's Health Development Programs, HIV or AIDS and STI prevention, emerging and re-emerging infectious diseases, integrated helminth control, food and waterborne diseases prevention and control, and national dengue prevention and control programs, tuberculosis control program, malaria control, schistosomiasis control, leprosy control, and filariasis eliminating programs, rabies control programs, lifestyle-related diseases prevention and control, and essential NCDs programs. In order to improve access to quality basic health services, there should be adequate healthcare professionals and workers across country who will provide these services. One of the strategies that may contribute in addressing this issue is the deployment of the health workers through the DOH Human Resource for Health Deployment Program. The program hires cadres of health professionals that will support and complement HRH at the local level, particularly in rural, unserved and undeserved communities. Majority of the health workers are deployed to LGUs that are not able to hire or retain health workers, and often these are low resource municipalities in geographically isolated and disadvantaged areas. The HRH deployed includes doctors, nurses, midwives, medical technologists, dentists, public health associates, among others. Health Facilities Enhancement Program. The Health Facilities Enhancement Program of the Department of Health aims to improve public health facilities by constructing new and upgrading and rehabilitating existing public health facilities across the country, such as barangay health stations, rural health units or urban health centers, and local government unit hospitals. The program assists in enabling government health facilities in providing affordable quality care and specialized treatments by strengthening the health system through HFEP. It can contribute on ensuring delivery of health services towards achieving health-related SDG goals. SDG 4. Quality education. Education and promote lifelong learning opportunities for all. Quality education. First, the bad news on education. Poverty, armed conflict, and other emergencies keep many kids around the world out of school. In fact, in developing regions, kids from the poorest households are 4 times more likely to be out of school than those of the richest households. Now, for some good news, since 2000, there has been enormous progress on the control to provide primary education for children worldwide. The primary school enrollment rate in developing regions reached 91%. By measures in any schools, that's a good grade. Now, let's get an even better grade for all kids and achieve the goal of universal primary and secondary education, affordable vocational training, access to higher education, and more. Target 4.1. Ensure that all girls and boys complete free, equitable, and quality primary and secondary education, leading to relevant and goal for effective learning outcomes. Target 4.2. Ensure equal access for all women and men to affordable and quality technical, vocational, and tertiary education, including university. Target 4.3. Substantially increase the number of youth and adults who have relevant skills, including technical and vocational skills for employment, decent jobs, and entrepreneurship. Target 4.4. Eliminate gender disparities in education and ensure equal access to all levels of education and vocational training for the vulnerable, including persons with disabilities, indigenous peoples, and children in vulnerable situations. Target 4.5. Ensure that all youth and a substantial proportion of adults, both men and women, achieve literacy and numeracy. Target 4.6. Ensure that all learners acquire the knowledge and skills needed to promote sustainable development, including, among others, through education for sustainable development and sustainable lifestyles, human rights, gender equality, promotion of a culture of peace and nonviolence, global citizenship and appreciation of cultural diversity, and of culture's contribution to sustainable development. Target 4.7. Build and upgrade education facilities that are child, disability, and gender sensitive, and provide safe, non-violent, inclusive, and effective learning environments for all. Target 4.8. Substantially expand globally the number of scholarships available to developing countries, in particular, least developed countries, small island developing states, and African countries, for enrollment in higher education, including vocational training and information and communications technology, technical, engineering, and scientific programs in developed countries and other developing countries. Target 4.9. Substantially increase the supply of qualified teachers, including through international cooperation for teacher training in developing countries, especially least developed countries and small island developing states. These are the key indicators of SDG 4. List of key government programs, activities, or projects contributing to Goal 4. First, free TVET programs. Free skills training assessment and other benefits as applicable under TESDA scholarship program. Namely, Training for Work Scholarship Program. The TWSP seeks to support rapid, inclusive, and sustained economic growth through course offerings in priority industries and key employment generators such as agri-fishery, agribusiness, agro-industrial, tourism, information, technology business process management, semiconductor and electronics, automotive, other priority manufacturing industries, logistics, general infrastructure, and new and emerging sectors. The program is addressing poverty reduction through Tibet for global competitiveness and WET for job readiness. Private Education Student Financial Assistance or PESFA. This program was established through Section 8 of Republic Act No. 8545, otherwise known as the Expanded Government Assistance to Students and Teachers in Private Education. PESFA offers educational grants to qualified and deserving college freshmen, both in degree and non-degree courses. The program seeks to extend financial assistance to marginalized but deserving students in post-secondary non-degree courses, promote TVET, contribute to the development of a competent skilled workforce, and assist private institutions in their development efforts by ensuring a steady supply of enrollees to their course offerings. The PESFA directed the beneficiaries on the choices of career to the critical skills requirements of the in-demand jobs in the labor market. It also allows for equity distribution of the opportunities made available through government subsidies. Universal access to quality tertiary education. The Universal Access to Quality Tertiary Education or RA 10931, which was assigned into law last August 2017, provides for free tuition and other school fees in state universities and colleges, local universities and colleges, and state-run technical vocational institutions, establishing the tertiary education subsidy and student loan program, and strengthens the Unified Student Financial Assistance System for tertiary education. SDG 5. Gender Equality. Empower all women and girls. Gender bias is undermining our social fabric and the values all of us. It is not just a human rights issue. It is a tremendous waste of the world's human potential. By denying women equal rights, we deny half the population a chance to live life at its fullest. Political, economic, and social equality for women will benefit all the world's citizens. Together we can eradicate prejudice and work for equal rights and respect for all. Target 5.1. End all forms of discrimination against all women and girls everywhere. Target 5.2. Eliminate all harmful practices such as child, early and forced marriage, and female genital mutilation. Target 5.3. Recognize and value unpaid care and domestic work through the provision of public services, infrastructure, and social protection policies, and the promotion of shared responsibility within the household and the family as nationally appropriate. Target 5.4. Ensures women's full and effective participation and equal opportunities for leadership at all levels of decision-making in political, economic, and public life. Target 5.5. Ensure universal access to sexual and reproductive health and reproductive rights as agreed in accordance with the Program of Action of the International Conference on Population and Development and the Beijing Platform for Action and the outcome documents of their review conferences. Target 5.6. Undertake reforms to give women equal rights to economic resources as well as access to ownership and control over land and other forms of property, financial services, inheritance, and natural resources in accordance with national laws. Target 5.7. Enhance the use of enabling technology, in particular information and communications technology, to promote the empowerment of women. Target 5.8. Adopt and strengthen sound policies and enforceable legislation for the promotion of gender equality and the empowerment of all women and girls at all levels. These are the indicators of SDG 5. List of key government programs, activities, or projects contributing to Goal 5. First, services for clients in centers and non-residential care facilities. The residential and non-residential care services of the DSWD cater to vulnerable and disadvantaged children, youth, women, senior citizens, persons with disability, other individuals, and families in crisis through the operation of the residential and non-residential care facilities offering the needed interventions. Under the residential care service, a 24-hour group is living provided on a temporary basis to poor, vulnerable, and disadvantaged individuals and families in crisis whose needs cannot be met by their relatives. Residential care facilities provide the following interventions: social services, home life services, health and nutrition services, educational services, productivity or livelihood services, cultural and recreational activities, and spiritual enrichment activities. The DSWD operates 65 residential care facilities in 16 regions. The implementing agency of this is the DSWD, and the target beneficiaries, we have the abandoned, neglected, or abused children, women, youth, persons with disabilities, senior citizens, displaced persons, as well as individuals and families in crisis. Non-residential, persons with disability, and bereaved women. Another project is strengthen monitoring and evaluation of the implementation of the GEWE Plan 2019-2025. The Gender Equality and Women's Empowerment 2019-25 is the midterm plan of the government on the implementation of initiatives towards the achievement of gender equality and women's empowerment. The plan's overall framework is informed by the Magna Carta of Women, the Philippine Development Plan 2017-2025, the Philippine Plan for Gender Responsive Development, and the SDGs. So these are the different Sustainable Development Goals, numbers 2, 3, 4, and 5. And that is all. Thank you.